In this episode, we will discuss Quantal dose effect curve. Quantal dose effect curve. Quantal dose effect curve is used if the pharmacology response is an either-or event or quantal event, all or none response. The response where all respond or none respond, such as prevention of convulsion, arrhythmia, or death. The patient or animal will appear convulsion or non-convulsion, will appear arrhythmia or non-arrhythmia, will appear death or non-death. Look at this graph. It's a quantal dose effect plot. Shaded blocks and the accompanying bell-shaped curve indicate the frequency distribution of dose of drug required to produce a specific effect. That is, the percentage of animals that require a particular dose to exhibit effect. The open box and the corresponding color curve indicate the cumulative frequency distribution of response, which are normally distributed, or sigmoid. What is the meaning? The shaded box and the accompanying bell-shaped curve. The shaded box is the blue one and the accompanying bell-shaped curve. The shaded box is the brown one and the accompanying bell-shaped curve indicate the frequency distribution of dose of drug. The open box and the corresponding color curve. Here is the open box and corresponding color curve is the blue one. Here is the open box and corresponding curve is the brown one. Indicate the cumulative frequency distribution of response. What is the frequency distribution and the cumulative frequency distribution? For example, there are 10 mice. We inject some medicine to observe their effect. Look at the graph B. The abscissa is dose. The ordinate is frequency of distribution. The first dose is 2 mg per kilogram. Only one animal responds. The second dose is 10 mg per kilogram. Another 4 animals respond. The third is 20 mg per kilogram. Another 3 animals respond. The other dose is the same. We plot the frequency distribution curve. It is a bell shape. Look at the graph A. The abscissa is dose. The ordinate is cumulative frequency distribution. The first dose, only one animal responds. The second dose, in cumulative frequency distribution, 1 plus 4 equals to 5 animal respond. The third dose, in cumulative frequency distribution, 1 plus 4 plus 3 equals to 8 animal respond. The other dose is the same. We plot the cumulative frequency distribution curve. It's a sigmoid. Again, if the ordinate we use the frequency distribution, we will plot the bell-shaped curve. If the ordinate we use the cumulative frequency distribution, we will get the sigmoid curve. Have you remembered the graded dose response curve? If the abscissa we use is concentration, we could plot hyperbolic shaped curve. If the abscissa we use are log concentration, we could plot sigmoid curve. Quantal dose effect, graded dose response. The quantal dose effect curve and the graded dose response curve summarize somewhat different set of information, although both appear similar in shape on the same logarithmic plot. The graded dose response curve indicate the potency and multiple efficacy of a drug. The quantal dose effect curve indicate the potential variability of responsiveness among individuals. True or false? Only in graded dose response curve, the curve could be sigmoid. The answer is false, because both the graded dose response curve and the quantal dose effect curve could be sigmoid. Quantal dose effect curve, ED50, median affected dose, is the dose at which 50% of individuals exhibit the specific quantal effect. It means 50% of individuals exhibit the specific quantal effect is dose we call it ED50. TD50, The dose required to produce a particular toxic effect in 50% of animals is called the median toxic dose, TD50. 50% of animals appear toxic effect. Its dose we call it TD50. If the toxic effect is the death of the animal, dose in the 50% of animal is called the median lethal dose, LD50. It means 50% of animal appear dead. Its dose we call it LD50. LD90 is the 90% of animal appear dead. Its dose we call it LD90. E is the abbreviation of effect. T is the abbreviation of toxic. L is the abbreviation of lethal. LD50 is the index of drug's toxic effect. The larger of the LD50, the smaller toxic effect of the drug.